This is Insight. Phone lines are open. Dial 384-2191.
And welcome to an Insight program for Friday, the second day of October already, 2020. On the Insight program with me here today, Marshfield Mayor Bob McManus. It must be the first Friday of the month.
First Friday. Glad to be here.
And welcome back.
Thank you.
And what you been up to? Anything?
Well, no, everything's running pretty smooth. No issues.
Okay. I was going to say this was, let's see, there was a council meeting last week on the 3rd? 2nd. Okay.
Right.
22nd.
Yep.
Okay. We talked about it here on the 23rd and in the news. And then now this week is one of those goofy, every time we have every time we have a fifth Tuesday in the month, that means that really there's nothing going on at City Hall, right?
Well, there's still a lot going on, but meeting-wise,
yeah,
we'll have the first meetings of finance, budget, and personnel will be next week. So the council doesn't meet until, I believe, the 13th. So it's 3 weeks in between council meetings, and there's a lot of business that goes on in between there. So right now, one of the issues that we're dealing with, and everybody's dealing with, is the safety with COVID. Steve Bargan, our last meeting, was concerned if we do need to do anything more for safety for city staff. There's a lot of people coming in. We're doing a lot of absentee ballots and everything else. What's very nice for the citizens of Marshfield to know is there's also a drop-off box. It's very convenient. So if you do request your ballot by mail, you can drop it off there, and it's very secure. It's right at the front door of City Hall. So you can go in there and drop it off at City Hall during the normal work hours, or you can use that drop box after hours, and it's very secure. So, but, with the election coming up, 4 weeks away, I guess, there's more people coming into City Hall, and we want to make sure that everybody is safe. We see the spike taking place in Wisconsin. We're very well aware of it. It's very concerning to see this. We're very worried about the hospital capacities and everything else. So, you still encourage, the mask mandate is still in place. So people need to wear masks at places they go and be careful. Obviously, if you have a compromised immune system, you should wear a mask really all the time. If you don't, then when you cough or sneeze, cover your mouth. The biggest thing, Mike, is that if people are sick, or even if they, sometimes you just wake up and you don't feel so well, or maybe you have a sniffle, don't risk it. Stay home. Certainly if the kids are sick, have them stay home.
Yeah, this is getting to the point where I think, when they say, it's another record day in terms of deaths or cases or what have you, and we have had a lot of those lately. And when they start mentioning things like daily records, I think more and more people, I don't know, at least maybe part of me hopes that more and more people are taking this a little more seriously than what they have been, because I think that's the main issue right now. I think there is a direct correlation between the number of cases going up and the number of people just not taking this seriously enough.
Yeah, I would agree with you. I mean, and part of this has to do with, we were told back when this first started, in March, that there's a surge coming, and then in April there's a surge. May there's a surge, and I think people got kind of, they weren't respecting the virus.
Right.
It's a nasty virus. There's no doubt about it. It's highly contagious. And so you go on, and I believe you kind of become invincible, or maybe you don't take it seriously. Yeah. And then you had you've got two teams. You've got the I'm going to wear a mask everywhere, and you've got the other people that say, I'm not going to do it at all. And it seems like those two teams have gotten further and further apart. Right. Just like in politics nationwide, we've got to do something about this country to that. But we're even seeing that there. So I think when we're seeing these record days now, I think people are just fatigued by the whole COVID thing.
Yeah.
You've got people staying home, and that has ramifications, you know, and you've got to do it for safety. So, but what we know, we're setting records daily for new cases, and we've got to be careful.
We do. We are sitting here without masks, but this room, I can tell you, is sanitized over and over again for obvious reasons. And the reason I know that is because I see it being done a couple times a day. And we're distanced, you know, enough to the point where we're safe in here. And see, it's, you know, just sounds better. You know, you got to sound good. And masks kind of muffle that sound a little bit. So we're trying to get the message out as clearly as we possibly can, you know. But, you know, I think, you know, maybe a big game changer, too, for some people will be the tweet heard around the world now. You know, the president and first lady have tested positive for COVID-19. And you go, wait, what?
Right.
When I first saw it, I had to do a double take, too. What was your reaction to that? Because if there's one game changer in all of this, that might be it.
It could be it. I was... you know, there's all kinds of. When I see a report, you know, when I get up in the morning, I'll fact check everything just to see if multiple sources do it. And it was interesting to see that yes, he did contract the virus, and the first lady is as well. So they're going to quarantine there at the White House, and as of right now, he's asymptomatic. His physician came out very close after that and said he believes that he's got a 60% chance, I think, that he will stay asymptomatic. So I really don't know when they make those kinds of ratios, how you factor that in.
Right.
It just gets back to the old adage of if you don't like the survey, change the survey.
Yeah. Ask some different people.
Ask different people what their percentage is.
In a different part of town on a different day.
Right. But I think your analysis is correct. I think that maybe opened up the eyes that, yes, this is a nasty virus. I mean, we've seen there's millions of people that have contracted it.
Yeah.
In the United States, over 205,000 have passed away because of it. And I know that, you know, I think there are people out there that are skeptical because what other co-issues did they have? Did they really die because of COVID, or was this kind of, you know, the final thing? So, with all of those things and all of those opinions, you can, oh my gosh, you can never really come down to the end of it.
No.
Be careful. Just be careful when you go out, especially if you have compromised immune systems. You know, you really need to think twice, maybe 3 times about going to those big, you know, groups and things like that. You've got to be careful.
Well, and the other thing is, you're right. If people would spend as much time worrying about themselves and what they're doing as they seem to be worried about what everyone else is doing around them, you know, oh, look at what so-and-so is doing. Look at what, I can't believe they're doing this. Well, why don't you just worry about what you're doing? And if everyone just worried about their business and not everybody else's, I don't think we'd be talking about daily record numbers.
Yeah, I think you're right. You know,
what do I know?
The world is just a weird place right now, especially with social media. And you even look what's on TV. I mean, people get, you know, what do they call it? Binge watching when they're watching shows. And some of the shows that they're watching are just way out there.
Yep.
And, you know, I don't know. And on social media, you've seen it's taken a very ugly turn. And people will say all kinds of different things. And it's like, we really got to get back to being nice to each other. Yeah. And it's okay. It's okay that people have different opinions.
Right.
You know what I mean?
Yes.
You know, it's like, okay, if you don't have my opinion, I'm taking my shovel and pail out of the sandbox.
Yeah.
I think we need to get back to that world.
Yeah, good idea. All right, Marshfield Mayor Bob McManus is with us on the Insight program today. If you've got questions or concerns regarding the city of Marshfield, feel free to be a part of the discussion here today on Insight. 384-2191, and they'll put you through to the Insight program here on WDLB. Stay with us. Hey, thanks for tuning in. The Insight program this first Friday in October. That can't be right.
Yeah, it's getting to that.
Are we on number 10 already?
Yeah, we're on number 10.
Holy moly, where did that year go? Oh, yeah, we were all safer at someplace else.
Right.
Not doing the stuff we were supposed to be.
Right.
the stuff we wanted to do. Marshfield Mayor Bob McManus with us on the Insight program here today. Mike Warren in for Jeff Cannon on the show today. So we were talking a little COVID stuff here to get the program going and reacting to the news. Obviously, POTUS, FLOTUS, COVID. And now the contact tracing begins, and who else in the White House may have it, and where did it come from, and so on and so forth. Beyond all those issues at the national level, where is the city at right now? Are you, with numbers rising? We talked about record numbers almost daily in terms of daily average cases, actual cases, deaths per day, and that sort of thing. Is the city now changing its official COVID-19 response, or what is the latest on what the city is doing right now, COVID-related?
Well, the city really isn't changing the response, because our response has been rather aggressive in, making sure all of the city buildings, people there are wearing masks constantly. We've got sanitizer around. And we're doing that to keep the public safe and our employees safe. So from that standpoint, everything is the same. We are in constant communication with Wood County, the health department there, and there's still a group of us that get together now every other week, about 20 leaders in the area, different organizations, including the clinic, including Wood County Health, the chiefs of our emergency services. There's a lot of people on this call. And so we're staying up to date on what is taking place as best we can. And we are watching the numbers. There's nothing official other than what we're doing nationally now. We're just hoping that maybe there's a little bit better understanding that it's a nasty virus. It is here. So wear those masks, use sanitizer, wash your hands, wash them a lot. And if you don't have to go out, just don't go out. If you are going to go out, then practice, good social distancing and be careful. We can get through this, but it's going to take everybody to do that. I think over the summer there was a lot of parties, there was a lot of people going out places, and those were probably some super spreaders, and we've just got to be careful of that. If we're not, it's going to get worse. So literally, there's a lot of people that work out there and that are worried about their rights being infringed on, and of course everybody needs to be sensitive to that. But if more and more people get COVID, that could really become a problem. So we're watching what's taking place within the state, and I will say both the state, Wisconsin Department of Health Services puts out a great update. They do it every day at 2:00, and I can imagine the person that's there is. It's every day by 2:00. It's done. That person does not let it go to 2:01. It's done.
You're right about
that.
that.
Even on the weekend,
yeah.
And they get good information. Wood County does a tremendous job, so we could see how many people within the city of Marshfield, and then number 2 within the school district of Marshfield, which is bigger than the city, how many infections there are that we've ever had, and how many active cases there are. So we could see that. And we just have to continue to be very, very careful and take this seriously.
So you have these meetings, these joint meetings, and you said, you kind of gave the list of who is all at the table, including the medical people. What are they telling you when they give, these weekly, or is it weekly?
Weekly. Right now, it's biweekly.
Biweekly.
It's every other Thursday.
So when they give their updates from their vantage point on the medical side, what do they say? What do they tell you, or what are they telling you about? What's their information coming out of their facilities?
Well, and because of HIPAA, they really don't go into it too much, but they do say there's an uptick, obviously, in the amount people getting the virus and people within the hospital, and they are in preparation. They're prepared either way. They're prepared for this to go up. They're prepared for this to go down. The healthcare, the Wood County does a lot of, the Wood County Health Department does a tremendous amount of education. You can call them, you can contact them, especially if you have COVID, to get updates on what to do and help them with their contact tracing. So it's interesting because we've got the universities, we've got the schools, superintendents, both public and private, the university, you name it. I mean, there's, like I say, there's about 20 different folks on this call. And we're just making sure that everybody is all on the same page and we're a united front going out to keep everybody as safe as we possibly can. But at the end of the day, we could do all the preparation we want. Where this goes is individuals that are out in the public that make the decision to go out or not. And with that, you cannot control people's freedoms.
I was just looking at a joint statement on increased COVID-19 hospitalizations put out today by Marshfield Clinic Health System, Ascension, and Spirus. I don't know. Did you?
I've not seen that yet.
Did you get those? I think this is just coming out. And I'll just read part of it quickly here. It says, our regional health systems are continuing to see an increase in COVID-related hospitalizations and patients testing positive, particularly in the last few weeks. We've been working hard for the last 6 months to prepare for this surge, and we continue to provide quality, safe care for our communities. And it goes on to say the numbers of COVID-19 cases and positivity rates have been rising across the Midwest. To help meet this challenge, we must work together as a community to take the steps we know can reduce the spread of COVID-19. Following the guidance of public health agencies by wearing a face covering, practicing social distancing, washing your hands, avoiding high-risk situations, and staying home while sick can all make a big difference in the health of our communities. We stand with public health officials in their educational efforts around these basic and essential measures as they work tirelessly to keep our communities safe. Now is not the time for any of us to become complacent. We are far from being clear of danger. And it goes on to say, in addition, it is more important than ever to get your flu shot. The Centers for Disease Control and Prevention recommend all people 6 months and older get flu vaccinations to protect themselves and others from getting the flu. It says, we have the power to turn things around. We need everyone to take this seriously to slow the spread. A joint statement put out today by Marshfield Clinic Health System, Spirus, and Ascension. So there.
Yeah, and it's pretty much what I was saying before, all the different precautions to take. And the good thing is the messaging is coming out to be the same.
Exactly.
No matter where you get. That's a real big thing. That's a very big helpful thing.
Because this is rare.
Yes.
Yeah.
So the messaging is very, very clear at the local level, at the county level, and even with our big healthcare partners. So that's a very, very good thing. But it is the public's, it's in the public's hands what they choose to do with it. We could either have these continue to increase, or we could go the other way and get our numbers down. And that's hopefully the way we're going to go. But it's going to take the public's input.
It is indeed. Okay. From COVID to what? I think the other headline at City Hall, if you were to go there, beyond the voting, and absentee voting and all that stuff that's going on now, beyond that, I would say this is what now, October. That is budget month, isn't it? This is the time when you get our little Christmas cards all ready to go for the mail, and you send out our little bills
and tell us what the little bills.
Tell us what the damage is going to be, right?
Well, it's very interesting because when you were just before the show, you were doing a weather update, and it was, I really enjoyed it. You said it was a little dry and it's not bad, and that's what this week and next week are, is just kind of a little dry and not bad. But if you look on your radar, you know that coming in just, 13 days on the 16th, we're going to get the recommended budget. And that's when the storm is going to be here. And I will say it's a very interesting process, and I hope that people will take an active role in it. They can, you can always come to a public meeting. You can also Zoom it. You could be there and you can call in, so you could be in there and see it that way. We got our local cable access channel 991 where you could see it live, or you could watch it on Facebook Live. So what we really tried to do is help it so that the public can see and be a part of everything that's going on. What we know, and we've talked about this before, is right now our current tax rate is $9.54 per thousand. I believe Ron Ahman said it needs to get over 10. Now, I'm not a real big fan of a tax increase right now, and I've said I'm going to fight it, and I am. And I know that the council members are all very diligent about this, and some have a thing of, look, we've got to take care of this. We've got to take care of this bill. We've got to take care of getting our finances right. But do we have to do that this year? And others are like, we just, we don't want to do anything to disrupt things. So it's got to be, and all of those opinions are good. They're representing the people of their district. So when we go to the budget meetings, it'll probably be 2, maybe 3 meetings. We'll be discussing that, and the department heads all come up and they go through what their budget is going to be. The council at that time has the opportunity to ask them questions, and then at the very end, then each council member will do it. Now, in the past, Pete Hendler was the chair of the Finance, Budget, and Personnel Committee. And the Finance, Budget, and Personnel chair actually runs that committee, not the mayor. It's the Finance, Budget, and Personnel chair, who now this year is Ed Wagner. So in the past, after everything was done, Pete Hendler, who was the alderman in District 10, would have each alderman go through, and they would have a time where they could bring up their concerns, and he went by one. Not sure how Alderman Wagner is going to do that this year, but it is, as the chair, it is how he chooses to run the meeting. And Mr. Wagner he's a very good alderman, and he takes this very, very seriously. I'm sure he's going to do a great job.
He really does dig deep. He reads everything, does his homework. This may be, you mentioned the different takes on the budget and trying to make up for these basically budgeting or accounting practices over the course of the last, 8 to 12 years, something like
10
that?
10 to 12 years.
10 to 12 years, where somebody did it this way, we didn't know it was being done that way, and now the new guy comes in and says, but it probably shouldn't have been done that way because that doesn't really tell the true story of that particular budget or account or accounts or what have you. So now the process is being changed, and we find out we have this kind of structural deficit type deal. And when you start to get all the different opinions of how to fix that, it's one of those situations where, yeah, they may disagree and they may have different opinions on how to do it, but it's one of those situations where nobody is really wrong. It's just which way do you want to do it, the more painful way or the less painful way?
Right.
And how many years do you want to take to fix it? This number or this number, right? I mean, that's kind of sounds like what's going on. They all have the same goal. It's just how quickly and how painfully do you want to get there?
That's a very, very good thing, but I do like the way you prefaced it, and you did that very soft. So that's good, but
but it could get ugly.
The way that you said it before was, during the prior 10 to 12 years, this person did it this way, and then this person that came in does it a different way. Well, let's just understand that the reason we do it a different way is because the prior way was done wrong.
Okay.
It was clearly wrong.
I'll let you say that. I won't say that. I'll just, yeah.
There is
okay.
no question about it, and it's infuriating. But at the same time, you could talk about the broken down car, but you got to fix it.
Yeah.
And so now we're left to where, okay, now we need to get in and fix this. I just think that, and we've heard some promising things. We've heard things are very financially solvent in the county, which is very, very helpful. And one of the things we look for at a local municipality is most of your income is derived from property tax income. And so there's a concern there. Are people paying their mortgage and their property taxes and whatnot, which the county always makes the city whole on that. So it's not like the city has to go out chasing the taxes, if you will. That's the county role. So we will always get that projected income always comes in very close to what it's supposed to be. So we're encouraged by that. But we have a structural deficit that we need to control. You'll remember last year we started off at 1.8 million in the hole. This year we're just a hair over $1 million. So we're getting the structure better. But this year, last year we were able to cut a lot of things and this year those are already baked in. So we're going to have to see where that lands. But for sure, it's and my position is, I think the citizens of Marshfield have had enough. You don't want to kick this down the road. You don't want to kick the can down the road. But at the same time, do you have to fix it all in 1 year, or could you fix it in 3? If it took you a decade to mess it up, can you give us 3 years to fix it? And in which case then maybe this year we can get a pass and then fix it in the next 2 years. But knowing that it is definitely going to have to come. We have to get our budget done correctly. And, and so we have to wait and see how that pans out. But those are going to be some interesting meetings, no doubt. What I appreciate about the Common Council is the diversity of thought process and the impassioned positions that they take. And I always respect that. And I think, it's great that you can have differing opinions that can still, for lack of a better term, be friends at the end of the meeting.
Well, and I always try to keep in mind that these people doing this city work, whether they're elected or appointed, they're taxpayers too. And so they're not trying to stick it to themselves either. Right. And so they're trying to watch the bottom line as closely as anybody because they get to vote on this stuff or recommend it or whatever. And why would they want to make themselves, pay more if they really didn't have to? So I always try to keep that perspective in mind. But, when you use the broken down car analogy, nobody takes 3 years to fix the car either. They get it back on the road as soon as they possibly can.
And that is okay. Now we'll go back to this car analogy.
So now I've volleyed back to your side.
You did, and that's good, and that's a fair thing. Sometimes what you have to do to the transmission is you need to fix it for a year, knowing that you're going to have to replace it in 2. So now the ball's in your court.
Touche. I quit.
See, you bring up a very, very good point because at the end of the day,
right,
realistically, the aldermen are going to make the decision for what the taxpayer has to do.
Yeah.
That's the rub.
Yes, it is. That's a tough decision.
Because then you have to go, for instance, in your analogy of, okay, you've got to fix the car. There are definitely people that feel that way.
Yeah. And
then there are other people that think, well, wait a minute now, let's just make it. And so realistically, at the end of the day, when you see, I've got to stop saying that. That's like the 5th time I've said the end of the day.
That's okay. I like the end of the day better than the beginning of the middle part of the day.
Right. So we just have to wait and see what happens. Yeah. But I just want people to be a part of it and to know that the aldermen do hear you. They do listen. Many times you hear that in government, no one listens and stuff like that. Oh, yes, they do. This is a great group of folks. And like I say, diversity as far as opinion or tactic or way we're going to do it, but they all have what they believe is in the best interest for their district and the city in mind.
Well, the other thing to keep in mind here is, you're talking about a possible, it sounds like they're keeping the door open to a possible tax increase. Now, keep in mind, there are, I believe, correct me if I'm wrong, 6 it's either 5 or 6 taxing entities on your when you get your tax bill. You're taxed by the city, the state, the county. We have a mid-state technical college district that taxes us.
Mm-hmm.
We have a school district of Marshfield that taxes us. Who am I missing? Is that it?
You've
Those
got it.
5 right there.
Yep.
Okay. So it sounds as though regardless of what any of the other 4 do, okay, it sounds like our taxes are going up regardless, or at least, I don't know, staying the same. I haven't seen the numbers on the school referendum. So on the ballot, there's a school district of Marshfield referendum, okay? So if that passes, I don't know, does it maintain, I can't remember, does it maintain the current spending levels of what under the current referendum that we're under that's about to expire, or is there going to be, are they calling for a slight increase in that?
Yeah, they're basically doing it's that referendum extending, and it's
Okay.
going to increase by about 500,000. So it's not going to be 2 referendums. It's basically just getting what's currently there or extending what's currently there.
Okay.
And they are, and I would encourage people to go to the school district website. I know they held a listening session the other day, and they're going to do another one in October, so people can really understand.
Yeah, Monday.
Yes. So people can really understand what the referendum is and how it affects the kids. I mean, one of the things, our school systems here in Marshfield, both public and private, are tremendous. I mean, tremendous with the different scores that they put out and graduation rates and everything else. So we want to make sure that they have what they need, but they are their own entity. We really have no say or what they do. So as you're exactly right, on 5 different entities, you might have 4 with no increase and 1 that does. But when they write out their taxes,
who gets the blame? It comes from the city, so that's where the blame lies.
Right.
But it may not be the city's fault, is what I'm
Correct.
saying. So.
Which is very important, is why you need to read your tax bill. And if you went through, one of the things when I was brand new as mayor that I went in, I looked at past tax rates, and it's just amazing. I mean,
you think it's bad now?
It was just amazing. For many years, there was no increases.
Well, but it used to be sky high.
Right.
I mean, they brought that way down in the last 30 years.
Right.
But I think where they went wrong is they did hold the line on any increases for too long. I think we undertaxed ourselves. And now we're to the point where you start using words like structural deficit. Well, that means that you should have been doing these small increases all along, and now don't come along after 6 or 7 years of no increases, and now there's this big jump. I think that's what really rubs people the wrong way the most when it comes to this kind of issue, right? We'd rather see these tiny increases year to year versus big jumps every 5 or 6.
You're exactly right. People can understand a 4 to 5 cent increase in their taxes because wages go up, health insurance goes up, the cost to snowplow goes up incrementally. So people can understand that, but for years without going it, and of course, during those years that the money was coming in from the TIF, coming over to the general fund and in essence overfunding, it doesn't look like you need that. But if they just would have done a 1% tax increase along the way, most people wouldn't even feel it.
Right. It's a couple of pennies here and there, basically,
Right.
Literally, right?
Right.
Per 1,000 now.
Correct.
So maybe a couple bucks.
Right.
But still,
A couple of bucks.
It's not a couple $100.
Right.
And that's kind of the difference I think we're talking about.
It very well could be.
Yeah. Ooh, that sounds painful. Well, I don't know if what's the postage term? Return to sender.
Right.
Address
There you
unknown.
go.
You might get mine back.
Right.
Say try again.
Right. But this is why it's very important for people the public, to be a part of the decision and to be a part of this.
Right.
So that when they see these meetings, then the public needs to step in and call their alderman and say, wait a minute. Yeah, I want you to fight this way, or this is my opinion. So the aldermen know which way that their folks in their district want to go. If they don't let if the public doesn't let their opinion known, then there's no way that we can help the public. Very important.
Very important indeed. Okay, Marshfield Mayor Bob McManus with us on the Insight program today. Again, if you've got a question or a concern, want to start a recall petition, right? Anything, right? You'll take the... You'll tell them how to do that?
Sure.
Don't like the mayor, throw the bum out.
There you go. There you go.
He's open for discussion. He's here. That's why we bring him in. 384-2191. Call the front office, and they'll try to put you through to the program. We have 15 minutes left for you. And we'll be back to our Insight discussion after this. It is an Insight program for Friday, October 2nd from AM 1450 WDLB, and also being shown on Marshfield Media Access. And are we live? Are we live?
Absolutely.
No, we're not today.
Oh.
We're not streaming live, but it'll be eventually rebroadcast.
Right.
So Marshfield Media Access. All right. Just wanted to mention that. So if you're just joining us and you say, shoot, I forgot the mayor was on. That's my favorite program, and I missed it.
Your ratings have to just fly.
Oh, we got to kick in the backup, generator, transmitter, whatever it is, more power every time you're on.
Right.
Because it just, it gets sucked down to nothing because people just flock to the, and then
Yep.
Marshfield Utilities is calling us and saying, what's going on down there? Your needle's bouncing all over. What's the mayor on again? Yep. Oh, okay. We'll kick in. It's
First
like,
Friday of every month. Just tell them to put it on their calendar.
It's like when Clark Griswold turns on his Christmas lights.
Right.
And the guy at the plant has to turn on the second lever.
Right.
That's how it is when you're on the program.
I get it.
We're kicking in the backup juice is on here. And we threw another mouse on the wheel to keep it going on the air. Marshfield Mayor Bob McManus on the Insight program today. Eventually, again, you can see it at Marshfield Media Access. All right. Let's see here. Where we
blinking light.
We what?
I think.
Do we? Yeah. Put on the. Okay. Put your ears on. We may have a caller here. Let's see if we have a caller. Hello, are you there?
Yes, I am.
Okay.
My question is, if we do not increase the amount that we are paying for taxes now, how that's going to affect our credit rating, and then if we need to borrow money, if we're not going to have to pay more money in order to borrow because of our credit rating going down.
Yeah, that is a tremendous question, because the Moody's rating, our Moody's rating did go down a little bit, and because of the structural deficit was there. And so it's not that we don't want to not take care of it. We absolutely have to take care of it. It's more or less the time frame that I'm concerned with. Can we do something this year in the form of reduced cost, maybe some other things that are out there that we could really look at, as opposed to an increase. However, the other thing is, if we want to maintain, right now we do still have a good Moody's rating, but if we want that to stay up so that we can, continue to get better rates, we just refinanced. I don't know if you watched those meetings.
I tried.
Oh, my God.
I tried. It was like watching a presidential debate.
Well, come on
not
now.
that bad. No, okay. I'm just.
it was very good. I mean, we saved an enormous amount of money, and even with the credit rating that we had,
Yeah.
I think the interest rate we got was like 1.5%.
Money is cheap right now.
I mean, it's those are tremendous. But her question in the bigger frame of things is really quite good. It's not like you can take 5 or 7 years, or you can't use the analogy of it took me 10 years to get in this hole. It's going to take me 10 years to get out. Nope. It's just the people are going to have to understand that we do need to fix this and come out of it, and it very well could result in a tax increase. And my only thing this year is with COVID, I just think people have had enough. That's the only if this was a normal year, a non-COVID year, and we'd be facing the same thing, I'd be saying plan on a tax increase. You know what I'm just because we know what we have, but because of this, I'm just thinking of other options.
Okay. Thank you, Joyce. Let's see here. Let's go back to the phone lines. Good morning. You're on Insight.
Yeah, good morning. I'd just like to make a comment, and I don't begrudge any of the city employees their wages or benefits. I don't care if they're with the fire department, police department, street department, anybody in City Hall. I don't begrudge their wages or their benefits. But the thing that I was concerned with, anybody that is hired from here on in, they should let or make them live in the city of Marshfield so that they share in the property taxes. They get good wages and good benefits. And of course, you can't make anybody that's living outside the city limits move back into the city limits if they're employed by the city. But anybody from here on in that's hired by the city, whether it's the street department or any other department, they should live in the city and share in the property tax. And I'll hang up and listen to your comment.
Okay. Thanks for the call.
It's definitely a great suggestion. A lot of people live outside, and when you're looking to fill certain jobs, there might not be anybody within the city that has a certain requirements that need be, and you cut off the talent base, if you will, by making a requirement to live here. His point is a good point, though. You know, if we're going to pay you, then contribute to that, and that's where the whole and I'm not saying this is being discussed or anything like that, but that was the premise of the wheel tax on a different thing.
I was just going to go there. That's the example that.
There's so many people that come into the city on a daily basis that don't contribute to the tax base, and then they wheel right out. So how do you do that? Well, the problem is for people that live in the city, not only do they pay taxes, but now they've got to pay this gas tax too. Yeah. So you really can't do that. But the premise of his question is a very, very good one. It's just really hard to do in a practical application.
It's tough. I see the argument on both sides. It's sort of like paying for okay, now where are you going to put the toll booths?
Right.
Or like you said, wheel tax or something. But I get it. You're getting, a job with the city of Marshfield is a good job, especially in, in any day and age. But, it's a good wage. It's a good benefit package. And so why shouldn't those folks, have to live here and suffer with the rest of us when it comes to that tax bill?
Well, it's a really, working for the city is a good job, and we've got great employees there. And we would, I think, to be in agreement with him, I would prefer that folks lived here so that you enjoy the city that you work for. All the aldermen, all elected officials have to live within the city. So, but it's a problem when you go to hire enough people.
The talent, you're right. The pool is limited if you do that. But I'm thinking of like emergency respond type people, firefighters, paramedics, police officers. Is there a residency requirement?
There's a residency requirement for the fire department, and there was just an amended one for the police department where the police can live a little bit further out. Okay. We always like it from a practical standpoint. Anybody that works for the city, that you that you live in the city, simply because then you're 5 minutes 5 minutes to get to work.
Right, yeah.
Maybe 7.
Why wouldn't you want to live in Marshfield?
You know what's interesting is
no offense to our, beautiful surrounding townships and great places, but I like being just a couple minutes from everywhere. I hate, even a few minutes outside of town, and I've done that actually. I've been in that situation, and I'm going, I'm 10 minutes away, not 5. But anyway,
when you're
plus you get all the services.
When you're in public life, you tend to hear all the complaints about the city and things like that. But I will tell you, realistically, I think one of the most incredible things about Marshfield is it really is a great place to live.
Yeah.
I mean, you can go at night and go on a walk. My wife, she's the most diligent person I know, and she's on a program right now, and she gets up and walks she gets up at like 5:00. I mean, the roosters aren't even up yet, and she's going out walking, and I know she's safe, and it's like that throughout the whole city. And for the most part, people are really, really friendly. You can go into festival, or you can go into anywhere, and just people are generally friendly, and it's a big relief from when you're on social media and then you're being beat up because you don't like ham and eggs.
Yeah.
It just doesn't make any sense. But it would be great if people worked within the city, but we don't have that requirement.
No requirement. Okay. Our time is up. Our session is over. Do you feel better?
I do.
Okay. The doctor is out now. I'm taking my sign down for the week.
There you go.
Hope this little therapy session helped.
Yep.
Got some things off your chest.
I feel a lot better.
Oh, quick. Do we have we were going to mention MOAC. Do we have time? Can you do it?
Oh, sure.
Can you
really
do it in
isn't
2 minutes? Marshfield Outdoor Aquatic Center.
It really is looking good.
They're making a big mess down there.
Boy, Bozen, they don't play around there at the Bozen Company, and they're down there. And if you go, they've got the earth moving equipment, and it really is coming. It really is looking good. The great news is, as of right now, we are right on time. So that's good. Now, I know you could say, Bob, we've only been doing it for a month or whatnot, but I don't care.
We've only been doing it for a month.
I don't care. We are on time. But they've done a great job, and that's really going to be beautiful when you come in from the south side to see that brand new Vandehey Waters. It really is going to be incredible. And again, I'd like to thank all of the committee members, the fundraising committee, and most importantly, the people that gave money to this project and donated money. It's because of them that this is happening, and we really appreciate it.
I can't wait. I can't wait what it's going to do. We've seen other communities who have these. Rapids now has one.
Right.
Of course, the one in Weston has been around for years. We've seen the benefits of these things. We've seen what they do.
Yeah.
And let's face it, HEFCO, I mean, she served us well, but, time to say goodbye.
Yep.
And it just, 86 years.
86 years.
Long enough.
Yep.
You've gone above and beyond.
Right.
we got to replace you.
Right.
Sorry, but it's time.
It's time.
The time had come.
Yep.
Mayor, thank you as always for spending some time with us. Certainly appreciate the updates.
All right. Thank you.
And we'll see you in November, right?
Yep.
Okay. Just a couple days. But is that before? No, that's after the election. That's after election day. Okay.
Oh, boy, that'll be something.
Ooh, we'll have a little something to talk about.
Right.
Okay. Cue the Bonnie Raitt song. All right. Thanks, Mayor.
Thank you.
Marshfield Mayor Bob McManus with us on the Insight program here this morning on AM 1450 WDLB. Thanks to the callers. Thank you for listening. Watch it. If you missed it, Marshfield Media Access. Oh, hey, I might go viral. Woohoo! See, Mom, I did amount to something. All right. Thanks for tuning in. It's the Insight program on WDLB Marshfield. We'll be back with a new show Monday at 10. Have a good one. Bye.